Good afternoon and welcome to today's webinar. I'm Michelle Heisler, Medical Director of Physicians for Human Rights, stepping in for PHR's Executive Director, Donna McKay. Thank you for joining us for our speaker series on health and human rights topics related to the COVID-19 pandemic. From our very first discussion in March of last year, we've emphasized that both science and a commitment to human rights are central to what we must do in terms of leading the way to address the pandemic. Today, I'm thrilled to welcome the hundreds of you live today with us to hear from a remarkable panel of experts. They're together going to unpack the destructive human rights and health impacts that the Title 42 travel ban at the US southern border is continuing to have. Our panelists will share insights from current litigation to end this policy, current adverse impacts, and what are alternative approaches that could instead be taken now to both respect the right to asylum and public health. Today's focus on the Travel 42 travel ban has particular resonance for me and my work with PHR. Since this policy was launched in March 2020, we at PHR have worked with medical, public health, legal experts throughout the country to refute its public health necessity and to outline better policies. I've also joined our network of clinicians to conduct medical legal evaluations of people seeking asylum who under Title 42 have been unable to present their cases for asylum and have been sent back to Mexico or other countries they fled. It's been heart-wrenching to document the mental health and physical health harms they have faced as a direct result of this policy that is still in place. I'm honored to welcome Amy Cohen, Dr. Amy Cohen, who's an invaluable member of PHR's Asylum network of clinicians. Amy is a practicing child and family psychiatrist. She's based in Los Angeles. She has more than 30 years of experience in assessing and treating trauma in children and families. She's conducted many medical legal evaluations of children and adults seeking asylum. She also serves as a mental health and child welfare consultant to attorneys monitoring detention facilities that hold children. She's deeply committed to support children and families who have been and continue to be adversely affected by US immigration policies. She founded and is executive director of a nonprofit organization focused on this work, Every Last One. I urge you to look at their website. They're doing remarkable work to support and protect children and families. Amy, thank you for bringing your expertise, your compassion, your passion to PHR today to lead this timely and important discussion. And I'll turn it over to you now.
Oh, Michelle, thank you so much for your kind introduction. I am so grateful to be a part of the work that this remarkable organization does, and very grateful to have been asked to moderate this event with our really, truly extraordinary panel of speakers. It is especially meaningful that Physicians for Human Rights is hosting today's event, as it was physician administrators from arguably America's most powerful medical agency, the CDC, who enabled a monstrous policy which has resulted in the incalculable suffering of hundreds of thousands of migrants. Acting against the advice of their own physician scientists and under pressure from the Trump administration officials, the agency's leadership allowed the Centers for Disease Control to be used to order a policy under an arcane public health code which would erect an impenetrable barrier to lawful asylum and force migrants fleeing some of the world's worst violence and corruption back into those countries where many have certainly since perished. Throughout history, we have seen the perversion of medicine to use to support racist agendas and to inflict suffering on maligned populations. Many of us would argue that the CDC's willingness to put its name to this Title 42 order represents another chapter in this dark history. Between March of 2020 and January of 2021, over 500,000 migrants seeking asylum were expelled from the United States without access to due process. This included over 18,000 unaccompanied children, some as young as 4, many with parents living in the United States. These children were universally tricked into getting onto expulsion planes when told that they were being taken to their families. Many of these children were returned to places they had no caretakers, excuse me, where they had been held by traffickers and kidnappers and all manner of monsters who would continue to hunt them. They were returned without concern for their fate, and the United States has never followed up to learn where they are and how they have fared. The sham underpinning and the inhumane nature of Title 42 made it obvious to many that this was a policy which would certainly end with the Biden administration. Shockingly, it has not. While the expulsion of unaccompanied minors has ended, the widespread removal of adults and families with very young children continues. While those fleeing the danger of Haiti and Ecuador and other more distant countries are flown back to their home countries, Central American and Mexican families are instead being forced by land back into the lethal border towns of Mexico. Many from Mexico are like the Guadalajara family my organization cared for. A family of 5 children, the parents had gone shopping for bread one evening when their father was shot dead by drug cartel members who he had refused to serve. Shortly thereafter, the mother began to receive death threats and was forced to flee quickly with her 4 youngest children, while the eldest, lacking a travel document, stayed behind hiding with his grandparents. There was nowhere to hide, and the death threats continued toward this family. The family were given shelter in a single small room from which they never ventured out. And then in December, the eldest child, venturing out at last to receive his travel documents so he might join the rest of his family, was shot and killed. For her own safety and that of her remaining children, this mother could not even see her slain son's body, let alone experience the support of others in his burial. Had we not partnered with attorneys and managed to get this family to the safety of the United States, there is little doubt that they would have been hunted down, found, and possibly all of them murdered. During the month of March alone, 17,000 Central American and Mexican families, many with very small children, were forced to cross bridges and into the arms of Mexican criminals who lay in wait to kidnap, rape, torture, murder. The state of Tamaulipas forbids the return of families with children under the age of 6. So Customs and Border Protection tells families with the smallest of children that they are being taken to Houston or to court and loads them onto planes. Instead, they are flown to El Paso or Tijuana, where the corresponding Mexican states have no such age restriction. 2 planes fly a day, one to El Paso and the other to Tijuana, where the Mexican limit of 100 migrants at a time are pushed over the bridges. Many do not know where they are going until they see the Welcome to Mexico sign. I am told that some at that point become terrified, weep, and plead to go back. These forced marches over bridges are often scheduled in the dead of night when there are no curious or disturbed onlookers, no NGOs, no one at all to offer aid or even to transport them to shelters. Under Title 42, migrants can neither work nor travel. They cannot purchase a bus ticket. They have no way to feed their children nor to escape towns considered too dangerous to visit by our own State Department. Many are simply left to the terrors of the street. In Reynosa, a squalid Title 42 encampment mimics the one during MPP, the Remain in Mexico program, where many were brutalized in Matamoros. The very few shelters all along the border are overrun. In Nuevo Laredo, the streets are so dangerous that mothers needing diapers or medicine for their children had better not venture out even in daylight. In Juarez, the shelters run by the federal government are said to be as dangerous as the streets, with the trafficking and rape of women and children a regular occurrence. As a physician, the stories of brutality and horror I have heard from migrants exposed to the criminals of Mexican border towns rivals those which I heard from victims of civil war in South Sudan. And the corresponding trauma, especially to children, is appalling. Little girls forced to sit in a chair for days witnessing the assault on their mothers. A 3-year-old boy forced to watch as his father was blindfolded with electrical tape, gagged, hogtied, tortured for hours. Juarez is said to be an international center for the creation of infant and child pornography, as well as for infant and child trafficking. These children, these victims of America's brutal policies will never, ever be the same. And for parents of these children, their anguish is compounded. They daily face their incapacity to protect and provide for their children. Many parents are absolutely brought to their knees, forced to face the appalling choice of whether to keep their children with them in such brutal surroundings or to send them across the river or the desert with human smugglers who agree to deliver them to the relative safety of the United States. In this way, Title 42 is yet another child separation program. Just as was zero tolerance, as was the Remain in Mexico program, and as is now the appalling separation and incarceration of tens of thousands of minors within locked Office for Refugee Resettlement facilities. I'm a physician who specializes in the assessment and treatment of child trauma. I am also a mother who can feel the agony of the mothers whose children are exposed to these policies. Like many of my colleagues, I am tired of treating the symptoms of the disease of America's inhumane policies. Title 42 must end. Toward the end of this webinar, if we have time, I would like to discuss with my fellow speakers some of the humane alternatives for the processing of migrant adults, families, and children coming to our borders. But for now, I'd like to introduce our wonderful panel and hear from them. Cynthia Pompa is a program officer with PHR's Asylum team. Previously at the ACLU Border Rights Center in New Mexico and Texas, she advocated and organized against abuses for federal immigration agencies and the militarization of the US-Mexico border. Dr. Hannah Janeway is an international and domestic health equity and leadership fellow at UCLA's Department of Emergency Medicine. Dr. Janeway is the co-founder and co-director of the Refugee Health Alliance, a wonderful organization with whom I have worked, a nonprofit that provides healthcare and addresses social determinants of health for asylum seekers at the US-Mexico border in Tijuana. Lee Gallant is a civil rights attorney at the American Civil Liberties Union, where he serves as deputy director of the Immigrant Rights Project and director of the project's Access to Courts program. He serves as lead attorney in the ACLU's lawsuit against the CDC Title 42 order. Welcome to all of you. It is an honor to be amongst you. Let me start with Cynthia and ask you if you can help to lay the groundwork for understanding migration trends. What is it that brings these families and individuals to the border? Are we actually experiencing a dramatic surge in numbers that is unheard of in American history?
Thank you so much, Dr. Cohen, and thank you everyone who's joining us today to talk about this very important topic. And that's a great question. I have interviewed migrant families for the last 6 years. I was just in one of the newest shelters in Juarez that had to be established to accommodate the thousands and hundreds of people that are arriving to the border due to Title 42. And I can tell you that the stories haven't changed. And the conditions, countries of origin, since Trump was in office, haven't changed. They've only gotten worse. There is widespread violence, there's organized crime, and there's corruption in the government, a government that is unable to offer protection. The stories that I've heard in 2018 are the same as I hear today. I've been prosecuted for being a trans person, for being a woman. My child was being harassed daily if they didn't join a gang. The gang was harassing me every day and said that if I didn't pay the money regularly, they were going to kill my whole family. So, for example, in Honduras, the President Hernandez is currently under investigation by U.S. authorities for suspected ties to drug organized cartels. So, for thousands of parents, this really coming to the United States to reunite with families is really the only choice they have to keep their child safe. They either decide to run away with their children, or even worse, make the really hard decision to send their children alone to meet a family member in the just to make sure their family can be safe. No one, I can tell you that no one wants to leave their home. Nobody wants to leave the place that they grew up with, the place where people speak your language and eat your food. But unfortunately, this is the only choice people have. And I think you bring up a great point on the numbers, right? Because across the media, we're seeing this narrative and stories and images about how there's a surge at the border, but it's really important to take a closer look and see that the increasing numbers actually did not start with the Biden administration. It actually started with the implementation of Title 42. And why is that? Because, imagine you're a family, you're traveling for thousands of miles, you get to the border, you're immediately turned back into Mexico, a country you've never been, you don't know anyone. What do? You try to cross again and see if you have any luck. That's safer than staying on the streets of Juarez or Tijuana. So what the numbers are showing are an increase in apprehensions, but just in March, 30% of those were repeat crossers. So people who have been expelled, tried again, and tried again. So I'm very glad we're having this conversation today. It's been 100 days since the Biden administration started. Biden promised to restore asylum to the border. Unfortunately, this illegal and really cruel policy continues to be in place. And I'm sure we get a chance to talk about this more, but epidemiologists, public health experts agree there's absolutely no public health rationale to categorically exclude a number of people when other travelers are able to come into the country. So yeah, looking forward to the discussion.
Oh, thank you so much. That's a really wonderful segue to Hannah Janeway. And I'd like you to address that, if you could, Hannah, about is there a public health danger? What are the options? And what are you seeing on the border in terms of the health implications of this policy for people who are being turned back?
Yeah, thank you so much, Amy. I mean, I totally agree with what Cynthia is saying. I think from the beginning of Title 42, we realized very quickly that the border was only closed to certain individuals. I, for instance, as someone who lives between Tijuana and the United States, I was crossing the border on 4, 5, 6 times a month, back and forth. There were no screenings, there was no temperature checks, and there was really no limitation on my ability to travel and to move back across the border. I think what we're trying to do is put a human rights perspective on what's going on. And, there's a big inequality there where you have someone like myself who actually, maybe I was someone who could potentially be a bigger risk to other people for COVID because I'm an emergency medicine physician, I work in healthcare, and I was allowed unrestricted access back and forth across the border, and I was allowed the freedom to move. And since March of last year, it's been pretty much stayed the same, that justification that the border should be closed because of COVID. But, I think as time has gone along, we've realized pretty quickly that with some very basic measures, such as masking and hand washing, people can move across international borders and people can interact in society, like go to the supermarket or go other places with masks on, and everyone can stay relatively safe from COVID. I myself masked every day at work and I stayed safe from COVID. And if I'm very exposed, I think anyone else can. So I think it was very apparent from the beginning that this policy was meant to stop very specific people, and specifically individuals who are trying to cross the US-Mexico border and apply for asylum. Like Cynthia and Tijuana, we've just seen the conditions get worse and worse. As you can imagine, it's just like a dam. If you close off the dam, there's going to be a huge backup that occurs at the other side. And every single place in the world had really difficult time dealing with COVID. The Mexican public health system, to begin with, was already extremely stressed to provide public health care to the needs of its own population. And then when you added on the addition of many, many, many more vulnerable people, it stretched it too far. And to the point where right now there is no public hospital in Tijuana that can see patients. You have to travel over 30 to 45 minutes to get emergency care. We had a child who is an asthmatic who had to travel 50 minutes in the middle of an asthma attack because there was no other hospital that would treat him because the other private hospitals turned him away. And so, this has really just been a huge nightmare in terms of trying to provide services in a system that was basically already stressed to begin with, and then has totally become overwhelmed, and the health consequences of that have been tremendous.
I also have heard, and you and I talked about this a little bit the other day, that that the problems, for example, for pregnant women are particularly exaggerated, and for women who have newborns. Can you speak to that a little bit?
Yeah, absolutely. So most of the women that we knew of, so we have our own midwifery clinic, but there are also a lot of migrant or refugees who go to the public hospital in Tijuana to get care, because that's the only other place they can go to get free prenatal care. And during COVID, that hospital closed. And so essentially it meant that none of these women had access to prenatal care. And our organization actually had to hire an additional 4 midwives to be able to just expand the load. But unfortunately, midwifery and home births are not safe for every patient. If you have a risk factor, advanced maternal age, preeclampsia, any of those things, those are not births that can be done at home. But what we were seeing is that those patients would present to the hospital with high blood pressures, proteinuria, and they'd be turned away time and time again. There was even one time when a patient was having basically a breech birth, arrived at the public hospital, and they didn't have an anesthesiologist. So they refused to treat her, and she started to give birth in the waiting room of the public hospital, and we had to send our midwives there to assist. And so this is the type of thing that I'm talking about. And then after the babies are born, then they basically have no care. There's no neonatal care. There's no one to be administering vaccines. There's no one to be doing all those really important checkups that have to happen after birth. So our nonprofit had to take responsibility for doing all those things, which is really, really difficult when that sort of care really needs to be provided by a larger system than we can provide.
We're also hearing that along the border, there are often shortages of water. And obviously, as we're moving into the spring and summer, these are going to be hotter and hotter periods of time, and that there are relatively new mothers who are unable to nurse because they're unable to get adequate fluids to keep up their milk supply. Is that something you're seeing as well?
Yeah, we're seeing huge water insecurity issues. We actually instituted or installed the first ever public water fountain in Tijuana to try to help with that. But also there's a new encampment as well in Tijuana, kind of like the one that there was in Matamoros, like you were talking about, is springing up along the border right now. There's only 2 bathrooms. There's no potable water. People are just living in tents during, the rainy season, which luckily is coming to an end. But there really is a lack of water. So we're seeing large amounts of dehydration in young children, lots of gastrointestinal illnesses, and we are having women having to try to move towards formula or other things because they don't have adequate access to water and are becoming dehydrated, which is drying up their milk supply.
Lee, I think everybody would like to hear from you, sort of the status of Title 42 litigation. But I'm also curious about how the sham nature, the obvious sham nature, the now admitted sham nature of the Title 42 order and the severe health and safety consequences to these migrants impact the framing of your legal arguments. Lee, I think you're muted.
Apologize. Thanks, Amy, and thanks, DepPHR, for having me. Yeah, we have believed that the public health justification was a sham from the get-go, that CDC got railroaded by the Trump administration. We, unfortunately, were not surprised that the Biden administration kept it. I think the signals throughout the campaign and then during the transition and then our conversations during the transition, the Biden administration, where we're going to get everything else done, but never a word about Title 42. So it then became clear they were going to keep it. We brought 2 lawsuits. The first was on behalf of unaccompanied children, challenging the use of Title 42 as to children. The second was for families. The Biden administration originally came in and said, we think this is perfectly legal, and unfortunately filed a legal brief that was identical to the Trump administration brief. There was zero daylight, and that was extremely troubling. The Biden administration then fortunately moved to say, we don't need to continue with the litigation. We will exempt children. We were pleased with that, so we've put the case on hold. So just in case they decide to reverse that policy. And that's why children are being allowed back in. Unfortunately for families, they've kept Title 42 going. And so we have this lawsuit. And what we are alleging is, first, Title 42 is a public health law. It was never meant to authorize expulsions. It dates back to the late 1800s. It's never in its history during the worst pandemics ever been used to send people back. And we said, yes, it authorizes quarantines, testing. Those may be necessary in certain cases, certainly testing, but not to deport people. Secondly, we argued, even if it could somehow be construed to authorize deportations, it cannot override the asylum laws, which have been enacted, subsequently enacted. And so we had those two arguments, and notably all three judges who have looked at the merits, and it spans different administrations, including one judge who was recently appointed under the Trump administration, agreed with us. So, and we also said, this is a sham from a public health standpoint. We knew the Trump administration was trying to stop asylum its entire 4 years. It then thought, oh, now we have the silver bullet. We can use a public health justification. They did that. The Biden administration has unfortunately kept it, notwithstanding, as you all noted, the country opening up, quarantines. They used to say, well, CBP officers are in danger, but of course now CBP officers have all been vaccinated, and if they refuse to vaccinate, that's on them, right? But the Biden administration came to us and said, will you negotiate over this? So our case is on hold, and we've been negotiating, and there are certain things we've got that will save lives, which I can't talk about because it's legally prohibited. There are other things I can talk about, which is the ability to get every day 35 vulnerable families into safety. Is that a substitute for ending Title 42? Absolutely not. So these abeyances on the litigation go in 10-day increments. And every 10 days, we decide whether the administration has put up enough, chiseled away enough at it, even though we can't tell people what they're doing. Hopefully it'll be seen on the ground. But I think we're getting near the end of our patience. I don't think the Biden administration has moved quickly enough. It's now clear that it can't be justified in public health. I mean, we don't think it ever could, but I think now there's just no question about it. And it's being used to control migration flow. And unfortunately, I think the politics are seeping in. The administration has been cowed by what they see as a political downside to allowing asylum seekers in. And I think they've been cowed by Mexico. And so those are obviously not proper considerations for not allowing asylum seekers. And I don't need to go into the harms that this is causing. You all have done that so well. So I can't tell you what we're going to do at the next time we come up for a decision point, which is this coming Tuesday. But I can say our patience is running if they don't take major steps, including saying when this is going to be done. And, if we knew it was going to be done in 6 weeks, would it be smart for us to go back to court, which could take a long time and it could end up in the Supreme Court? Those are calculations that we need to make. But right now, the Biden administration is not saying when it'll end, and it's not making enough inroads. So, that's where we stand. And I want to just go back to a point you made, Amy, about the CDC. The reporting was overwhelming that CDC didn't want to do it during the Trump administration, and the White House overrode them. And we would have liked CDC to come out during the Trump administration and say that's what's going on. They didn't, but fortunately, there was reporting through sources. I don't know what's going on at CDC now, but we would like to see them stand up. I think ultimately, you all are doctors, and I think they just need to stand up now and say, hey, enough is enough. We're either going to resign or we're going to put a public statement out. And if you, the Biden administration, want to criticize that or fire us, then maybe they're going to have to take that heat. I mean, obviously, that's a tough decision for everybody. I'm not advocating that any individual put their job or on the line or that kind of thing. Everyone has their own circumstances, but I do think as an entity, CDC needs to stand up. I mean, I know from former CDC people, and you all know even better, they are appalled at what has happened to CDC being used in this way. But we'll have to see, and I think it's literally day to day, but the hardship is just so great now. One thing I don't think people understand is that although the Biden administration is saying that no family can come in, the truth is that through various exceptions, only 1/3 of the families are actually being stopped and sent back. But that 1/3 represents, as you all have pointed out, thousands of families and untold hardship. So it needs to be, done. But I'm not even sure how the Biden administration is playing the communications narrative and the politics, because at this point, you'd think they would say, well, we still have some work to do on single adults. I mean, obviously, single adults can be in just as much danger and need to come in legally. We think there's zero difference between single adults, children, and families. They all are entitled to apply for asylum. But just as a communications narrative, as a humane thing, you'd think the Biden administration would have initially drawn the line between single adults on the one hand, except for the most vulnerable of them, and on the other hand, families and unaccompanied children. Because right now, you have these families there, it's a disaster for them if they can't get in, or they're doing what Amy has pointed out, Cynthia's pointed out, is it's forced self-separation. They're just having to make this brutal choice. Do I at least get my child to safety, even if it means I may never see them again? Or do I keep my child with me, and that means the child doesn't have a better life? And so is that the same family separation practice that Trump had, where they literally were ripping kids out of the parents' arms and sending them and not giving the parent choice? No, and I would never be suggesting it. But on the other hand, the net effect is that families are being separated. So I hope, we can draw attention to what's going on the border. It is, for, I think, a lot of the American public, sort of sight unseen. And that's why these webinars are so important, and particularly what you all as doctors are doing to shine a light on it, because I think that brings an added, sort of weight to it and a different voice. And so that seems to me so critical.
Two things. First of all, I think that I personally would argue that the compelling of parents to separate from their own children adds another layer of anguish for both the children and the parents. And we continue to rip children from the arms of psychological parents, grandparents, aunts, uncles, and so forth. So child separation continues under the Biden administration. It's not taking children from their biological parents, but from a child's perspective, a grandparent, a sibling, an aunt, an uncle may represent exactly the same psychological bond. And from the perspective of trauma, the damage is equally severe. The second thing I want to raise, and this goes back to something that Hannah had mentioned, is that the Biden administration was proud to say that they were going to end the Remain in Mexico program, the MPP program. And we have seen the rolling out of the evacuation of at least some of the people who've been in MPP, though it's been somewhat chaotic. Those people who have been in Mexico, some of them for almost 2 years, have been brought across the border with a screening exam that is done on the Mexican side. And that has presented no public health problems. So there is this, contradiction where certain populations that are specifically designated by the Biden administration seem to offer no public health danger if they are screened in these really very basic ways. And yet there's this justification that other populations simply cannot come across. Is that part of your legal?
Yeah. I mean, so I would tell you that, it's complicated. And From a public health standpoint, probably not as complicated, but from other vantage points. And one thing that we're getting through our pipeline 35 families in a day, and so that could be over 100 people. And we have now negotiated for a larger consortium of global NGOs who may have the ability to hire security, because it's gotten so dangerous for the smaller NGOs, to up that number. And that testing will be done on the Mexican side, like with MPP. But I will tell you that there are a lot of NGOs who are not pleased with testing being done on the Mexican side. From a public health standpoint, it may very well make sense, and it may be the easiest way during this emergency time to deal with this. But a lot of NGOs feel like any kind of outsourcing, extraterritorial processing is dangerous as a precedent, especially if what it means is if you test positive, you can't get over until you test negative, which is the case with MPP, that you have to be able to get onto American soil immediately. And so those are all complications that, you know, we're working through, and a lot of people have different views about it, and some are worried about the precedent. Others are saying, look, these families are in danger. Let's do whatever we have to do. And if it means testing on the Mexican side, so be it. But there are all those complexities swirling around. I do think from a public health standpoint, testing on the Mexican side, and if it can facilitate, and the Biden administration then says, well, okay, if you can get all that testing done, I think we need to ramp up the testing on the Mexican side. As you all know, it's not always that easy for people to find tests. It's not just the money, but it's also going to dangerous places to get the testing. So we'd like to see NGOs be right there so to be able to test. But I do think it's one of those issues where NGOs have varying degrees about how much we should be doing outside of US soil.
Thank you. I want to take a moment to introduce our other panelist who we weren't sure was going to be able to join us. We're so grateful that she's here. I certainly am. Linda Rivas is the Executive Director and Managing Attorney of Las Americas Immigrant Advocacy Center, an organization dedicated to the legal needs of low-income migrants. She is also the co-founder of the Borderland Immigration Council. She is situated in El Paso, so she is right there seeing what goes on every day. Linda, I'm so glad that you could join us. She is having a bit of a child illness issue going on, so we understand that you may be able to only jump in and out, but I'm glad you're able to be here at all.
Thank you. Yes. You know, like many of the people that I serve, I am a single mom. My daughter was sick last night, and I just, you know, I knew today I was going to either be able to do this or not. And so, you know, honored to be on the panel. I'm sorry, I'm really just kind of going to be off and on, but I did want to mention what I'm seeing. I'm going into Ciudad Juarez several times a week. I am speaking to people who were recently returned under Title 42, as well as working with people who are getting ready to come in after having been an MPP for 2 years. And it's this great juxtaposition of seeing what the government can do in a creative way to wind down a system like MPP, and then also seeing at the same time what the government can do and put families through and people through under the expulsions of Title 42. And a little bit what my fellow panelists spoke to, you know, it's a lot of, we're still seeing a lot of cruelty, you know, on the ground by DHS. We're seeing these families essentially being lied to, saying, oh, you know what, you're going to get to see a judge. It almost feels like Border Patrol didn't throw away their script from MPP. And they're telling people, you're going to see a judge, and the judge is going to make the decision for you. I'm not going to make the decision for you. But that is, you know, that is not the case. Then they find themselves expelled. Sometimes they don't even know where they are. And something that really stood out to me is the children remember. You know, I've interviewed families where the child, you know, doesn't want to separate from the parent. They'll be in the parent's arms, and they remember that the agents laughed at their family as they were expelling them. You know, there's still a lot of cruelty going on. And you know, as Lee spoke to the exemptions, Las Americas is a small nonprofit, and we've been working on some of these exemptions. And we also see here in we see two things that really impact the community that I think are important. El Paso, Juarez are sister communities. When we have gotten some of these exceptions into Title 42, we have a whole welcoming coalition that has been prepared for months to welcome. Our folks, our clients that are brought in under exceptions because of vulnerabilities are tested in conjunction with our NGOs and our local government. They're tested, and so we have the ability to do that, and we have expressed that to the government, that we are ready to welcome in many ways that include keeping our clients safe and keeping our community safe as well. And what's happening right now is, instead, as we continue to expel people on a daily basis, we're also expelling COVID-19 to a much more vulnerable city of Ciudad Juarez when it comes to vaccinations, COVID levels. Just 2 weeks ago, they had to shut down again. You know, El Paso is on the other side of that. We're one of the leading cities in vaccinated people in Texas. That's a pretty big deal for us as a border city, and we're very proud of that. So Title 42 makes no sense, and it's incredibly harmful, not only to these asylum-seeking families, but it's also harmful to this binational community.
Amy, I wanna add on to what Linda is saying, and thank you, Linda. Because I think one of the hardest things to see is, you know, all of us have worked under the Trump administration in the protection of rights. And we're very familiar with the cruelty that migrants went through under that administration. And it's good to remember a lot of, you know, the agents remain the same. And like Linda's saying, it seems like they're repeating the same script. It's really, really heart-wrenching to hear the stories on the Mexican side of the border. Border Patrol agents told families, you're walking over to Houston, that's the detention center, and that was Mexico. Mm-hmm. Families were so confused. Like there's absolutely no order that says that you have to confuse people in the process. It's just adding another layer of cruelty. And the level of confusion that it's really upsetting that the administration hasn't been clear, hasn't been upfront about what is it that they're doing, like Lee's saying, until when. The level of confusion is driving people desperate. You know, people are hearing different things. They want to get another chance. Some families are let in, others, instead of staying at a shelter in a process, they try to leave, they try to cross again. It's just incredible, frustrating, and just really, really unsustainable.
Thank you. Thank you both so much. Your voices are so powerful because, as I know, you're there and you've been there and you're there every day. And there's nothing quite like that sort of granular experience, which unfortunately, I think sometimes is removed a bit from those who are making policy. And this notion of how they're sort of using the same old systems which didn't work then or were cruel then and continue to be cruel now is certainly something my organization is seeing in the processing of what they're calling unaccompanied minors, tens of thousands of whom are actually small children being pulled from the laps of grandmothers and aunts and uncles and so forth, and then put into what is now this ballooning vast system of enormous facilities where they're taking 5,000, 10,000 children into places like Fort Bliss and having them watched over by international security groups, not unlike Blackwater. So that sort of disregard for the humanity and the safety of adults and families and children who are fleeing, as you all have been describing, some really unspeakable, impossible situations of violence. Their houses are burning down. They have to get out. They do not have a choice. So one question that has been asked to me on a number of occasions is, how do we explain the Biden administration's seemingly rather cold attitude toward the suffering of these children and families and adults? Certainly, it's an administration that came in touting its own, wish to be more humane, wish to reunite children, although the children they were interested in reuniting seem to be those who were separated 3 years ago, not ones who are continuing to be separated today. How do we explain this? I mean, I have my own theories about this, but I would love to hear yours. Cynthia, you want to start?
Yeah, well, I was going to turn to Lee. I mean, it's really disappointing, right? Like, oh, this is not enough, that people's rights and dignity is not enough, but bottom line, it's illegal. So yeah, so maybe Lee can speak about that.
Yeah, it's certainly illegal in our view. I think if the Biden administration were represented here, what they would say is, we very much care. We have been left with a mess by the Trump administration. There is a backlog of people. There was a dismantling of the infrastructure necessary to do this. We are trying to build a system. It takes a little bit of time. And if we just let everyone in, there's going to be chaos and we'll go backwards. And so this is a necessary period while we move to a more efficient, more humane process that's going to go beyond anything we've seen.
So can I
Yeah.
respond to that, Lee? And I want to bring other people in, because this is something I really want to address. And I think there is a genuine question of, not just what should we stop doing, but what should we be starting to do in terms of creating systems along the border which do a much better job of processing children who are coming, of processing adults and families who are coming. And I really, I'm not seeing the infrastructure being created to stop the separation of children from families, to enable a much more humane admission of people who are in crisis at the border. Is that something any of us are seeing? Is that something we can together conceive of? What would it look like? How can we help policymakers to have more imagination in terms of creating these structures?
Well, so what I would just say, and let other people jump in, is I don't think you'll see it physically. I think what the Biden administration is doing is saying they are developing it. It takes a lot of time. And just the fact that you're asking the question about how does that look, and there's no sort of obvious answer about how to do it, is I think what the Biden administration would say to you is, this is very complicated. And if we don't want to just tinker around the edges, but we want to have some really new efficient process, it takes a long time. I'm just telling you what they would say. I'm not endorsing it, but and that's what they would say. And so I think what they would say is, look, we can't just open the ports. There's going to be chaos. We would say you should do that while you're trying to figure out more efficient system, and you need to do that more efficient system quickly. But this whole Title 42 question and the border raises questions that the American government has been grappling with for a long time. And there are a lot of people grappling with it. And there are a lot of people who have put forth comprehensive solutions to the Biden administration. They say that they will be unveiling something soon. We'll have to see, and we'll have to make sure that it actually is more humane and more efficient, because you're absolutely right. We need a better process at the border. It needs to be more efficient and it needs to be more humane. Whether the Biden administration will do that, how long it will take them, and whether they should be ending Title 42 in the interim are all the questions that we've been asking and pressing on, because I think this interim step is horrendous. They need to be doing the right thing even while they're doing it. And, why they're doing it, do they genuinely not care? I would not put that on them. And we know a lot of good people, but are they being, to me, it feels a little bit like where there's a will, there's a way, and then they need to understand that they can't let the politics of it get in the way. And if they're genuinely saying it's very hard to do, well, that they just need to get it done. And, it is hard to do. I mean, because the very reason you're asking the question about what does that system look like, and it's not obvious to everyone, means it is hard. But we can't have all these families being harmed in the interim. And there are a lot of good solutions out there. And I think they need to adopt one, because there's no shortage of good solutions being put forward to them.
Well, certainly
Exactly.
our organization has solutions to the unaccompanied minor issue, which would be quite different than what we're seeing now. But Hannah, what are your thoughts about this?
Yeah, I was hopeful only for my patients, but I'm not surprised at all by the Biden administration's lack of change in overall policies. I do agree that this is something that's been going on for a very long time now. And I mean, I think we can remember just about a month ago, the Biden administration convinced Mexico, essentially what it sounds like in a meeting, to shut down the southern border an entire year into COVID for under the reasons of COVID itself. I mean, they're trying to push the asylum processes back into to people's home countries, but also it's not sustainable for them to stay there because they're in danger. So that solution doesn't make sense either. And I think as physicians and as care providers and as activists, or wherever people fall on the spectrum of why they're here and why they care about this issue, I really think we need to start thinking more creatively just about these larger structural forces that are causing migration, are causing suffering, and are making it so that some of us have the right to move and the right to stay, and other of us in the world don't have the right to move or the right to stay. And those large infrastructural forces are really what we need to be combating. We need to be changing systems so that people actually have the right to stay and the right to move, and borders become less meaningful in that entire system. And that's a more abolitionist perspective and kind of scary to policymakers, but I do think that really is the ultimate solution, is to step back and say, none of this really makes sense, because it really is always about whatever solution you can find that restricts migration, or makes it so that we don't have to see this right across the border anymore. It's pushed back. All of those systems rest on the oppression of people that are people just like you and I. So that's kind of my perspective. I guess that's why I'm not surprised, because that is a trend in the United States for quite a long time now.
And I'll just add, Amy, and thank you, Hannah, for saying that in the short term, hopefully not that long term, PHR has been advocated for a mix of new solutions like welcoming centers. Can we have other than Border Patrol agents welcome people who are trained to deal with families with children, health professionals welcoming, talking to these people? And actually, the Border Patrol has the ability to process people fairly quickly, and they have done even during the Trump administration. Even before COVID, sometimes it takes them 2 hours. There's no need to detain them in the hieleras or the coal cells, the crowded cells that we've all seen. But it really seems to be like there's no will to find some operational solutions from my perspective. And in 2016, there was for about a year and a half, there was a family case management program that had about 99% compliance with ICE and immigration court. Right. What does it mean? That families had a case manager helping them situate in the places that they're going, helping them find out where is their court date. Everybody, you have no idea how many times families are released with a court date. They're going to New York, but the court date is in San Francisco. It's so important. They do have family members in the US. They're going with family members, but it's so helpful when a caseworker is there to just help you navigate the system. And it's successful, it's proven, it's cost effective. So I think there are some solutions out there that have already been used that could hopefully are being considered to be implemented soon.
I mean, we're seeing that just in my little organization, because we do case management. Technically, we're sort of an emergency stabilization and reunification organization, but we can't, once kids are reunified with families, we can't just let them go. So we have a set of volunteers who make sure that they have a warm handoff to attorneys, that they get their children registered in school, that things are stabilized, because it's tremendously confusing. I mean, I think there's this notion in the United States, everyone wants to come to America. Everyone actually doesn't want to come to America. And the transition for these families, as you've mentioned, as has been mentioned before, is so challenging and so difficult. Particularly for families from indigenous areas whose primary language is not even Spanish. And the complications and the confusions of the legal system and of the school system and so forth really become an impediment to what they want to be able to do for themselves and their children. They want to comply with the expectations. They don't want to get themselves into trouble. They want to show up at the right court in the right ICE agency at the right time. So those sorts of supports, as you say, are really critical, and building that. So thank you so much for that. I want to just give everybody, I know that there are people in the audience who are interested in helping. And I want to give Michelle time to wrap up at the end. If you all want to just go through what people can do through your agencies, individuals, to assist with this problem, that'd be great. Cynthia, you want to start? You're here.
Sure. Yes. So I mean, I think that on the chat, we have a link to our petition to continue to tell the Biden administration to end this policy, and we continue to make that ask every day. If you are part of a medical association or an organization that wants to join this call, please let me know. Get in touch with us, and continue to share the word about how public being misused, the authorities being misused to control and push some people. Yeah, I think just continue to stay in touch and learn about these issues and spread the word.
Thank you. Hannah, what about your organization? How can people help?
Yeah, so Refugee Health Alliance, you can check out our website, which is www.refugeehealthalliance.org. We always need any sort of clinician, care provider, mental health professional in Tijuana and also remotely to do medical legal work. We do a lot of work on humanitarian parole, getting people across for medical vulnerability reasons, and work a lot with the legal community. So we pretty much are open to anyone helping us. If you have any creative ideas and want to make our organization better, please just contact us through our website.
Lee?
I know we're out of time, so just quickly, the ACLU has a website with an immigration area that suggests certain things. And I would just say it as Cynthia said, keep speaking out to your congressperson, to the president, let them know that people in America actually care what's going on at the border. It really makes a difference.
Thank you to all of you. To the audience, my organization is called Every Last One. You can go on everylastone.org. We adore and need our volunteers, so anybody who is willing and able to do that, I really appreciate it. Thank you all. Michelle, I'm sorry we're running a little bit late, but I'm going to turn it back to you.
This is perfect. So thank you to all our panelists for outlining all the reasons why the Title 42 ban must end now. It was instituted for political reasons and shockingly is being maintained for political reasons. As panelists also described, people seeking asylum can be processed and followed so as to respect human rights and public health. And I will say, and I say this also as a professor of public health and medicine, is that we won't regain our faith that we can trust what our federal government, what the CDC tells us about science and public health, as long as they use spurious public health arguments to deny people their rights under national and international laws. And again, this series is very much focused on a science-based approach to addressing the pandemic. So thank you guys. Thanks so much. We won't have a webinar next week. Please stay tuned about the topic of the next session in PHR's speakers series. You can see recordings of all our past webinars in this series in the chat box. Also, if you haven't already, please register to receive PHR emails that will tell you about future events, so you don't miss any of these compelling conversations. So thank you and Godspeed with all of the tremendous work everyone on this screen, on this Zoom screen are doing. And thanks all for tuning in.
Thank you.
Thank you.
Thank you all.